Before we start, we would like to acknowledge the traditional owners of the land on which we all stand and pay our respects to all Aboriginals and Torres Strait Islander elders, past, present, and emerging, as they hold and pass on traditional knowledge to up and coming generations. This presentation will firstly explain what birthing on country is and why it is so important within the Indigenous community. So, what is birthing on country? Birthing on country is the birthing culture that involves traditional practices and a connection to birth on the land of the Indigenous ancestors to ensure that the woman's baby when born has spiritual connection to the land. Birthing on country supports the Australian College of Midwives philosophy by using an integrated, holistic model of care approach, including labour, birth, socio-cultural and spiritual factors. Birthing on country provides safe, respectful and appropriate cultural care which transfers into community, leaving a positive impact on the mother, her baby and her family. Birthing on country is a cultural tradition that has thousands of years of knowledge and practice with many more to come. Supporting women to birth on country leaves the mother feeling safe, respected, personally as well as culturally, empowered to ask questions and make decisions, overall assisting in maintaining maternal and fetal well-being, resulting in more positive health outcomes. When an Indigenous woman gives birth off-country, away from ancestral homelands, the traditional belief is that it breaks the child's spiritual place in the community, raising emotional, social, and spiritual issues for the mother and her child. This negatively impacts the mother and the baby's losing sense of belonging. Taking a woman off her land to birth in mainstream hospitals can cause the woman to feel unsafe, fearful, and raises multiple challenges, not just for the woman but also her family. For example, the woman is left on her own with minimal or no family support, leaving her feeling isolated. As the woman may not speak or understand English very well, she may interpret information wrong and may not feel comfortable enough to ask questions. She may feel embarrassment while not being able to engage. It can also impact her financially. Some women or their families may need to pay for travel, accommodation, or other expenses for weeks. Without birthing on country, health professionals lack cultural awareness. The significance of birthing on country is vital to Indigenous women as health outcomes are poorer compared to non-Indigenous women. Birthing on country improves maternal and infant outcomes. It also allows the essential connection between birthing on land and a place of belonging to the mothers and their babies. Birthing on country values Australian Indigenous ways of knowing and learning, while it includes inclusion of traditional practices, land and country connection. It empowers Indigenous women and promotes a holistic and cultural model to improve birthing outcomes. Birthing on country supports the Australian government's aim to close the gap by reducing disadvantage amongst Aboriginal and Torres Strait Islanders. Birthing on country should be understood and defined as a metaphor for the best start in life for Indigenous babies.
Indigenous Australians experience poorer health than non-Indigenous Australians, but they do not always have the same level of access to healthcare. The differences in access may be due to factors such as remoteness, affordability, and a lack of cultural safety. For pregnant women, this can mean lack of antenatal care throughout pregnancy, as well as lack of medical attention in the case of an obstetric emergency. These risks can be minimized by ensuring health clinics with the ability to provide medical care are close by and accessible. To ensure that the care provided remains culturally appropriate, more Indigenous midwives are needed. Other health staff should complete cultural awareness education to ensure that the culture is always respected and that the woman and her family feel safe in the care that they are receiving. The Berthagon Country project is a project that aims to improve birth outcomes for Indigenous mothers and their babies. This project's main goal is to establish models of maternity care that is culturally appropriate for Indigenous women and their families. This includes Aboriginal midwifery group practice, allowing Aboriginal and Torres Strait Islanders to birth at a hospital with a familiar midwife, and even standalone Aboriginal birth centres. One of these projects is the Birthing in Our Community project. The Birthing in Our Community project is a joint program between 3 organisations based in Brisbane: the Institute for Urban Indigenous Health, Aboriginal and Torres Strait Islander Community Health Service, Brisbane Limited, and the Mater Health Service. It was an agreement between these organisations to share resources and together redesign services for Aboriginal maternal and infant health. The result is providing a midwifery group practice model of care tailored to the needs of Indigenous women and their families. This service gives Indigenous women access to maternity care 24 hours a day, transport to appointments, childcare while attending appointments if needed, and access to allied health services such as social work and mental health. This Birthing in Our Community also ensures that its employees are providing care that is culturally appropriate by ensuring that they attend monthly cultural education days. There are many ways we as healthcare professionals can implement and improve birthing on country, such as advocating and supporting culturally appropriate care for Indigenous women and also their families, ensuring yourself and your work colleagues have completed cultural training, advocating for accessible healthcare services in rural and remote areas, and also by keeping up to date with current birthing on country projects. There might just be a project that you may be able to be a part of or help in some way, even if it's just making noise about the cause. In conclusion, birthing on country has been proven to give Indigenous babies and their families the best start in life. We have gathered information to advocate and promote awareness of the cultural needs of Indigenous people. This is essential for them to receive appropriate medical care during pregnancy, birth, and during the postnatal period. As Australia, we are lacking in Indigenous midwives. We need to further educate healthcare professionals about culture and traditions and why these are important. To help ensure the appropriate care is provided, Australia needs to increase the number of Indigenous midwives in order to be able to provide culturally safe care for all Indigenous women and their families.